We have a very interesting discussion for you today around AI and ultrasound and how it can help improve access to healthcare and health efficiency for healthcare delivery. I am very privileged to be joined by an esteemed set of panelists here, my colleagues who I work with every day. And it's a fantastic topic that all of us are really excited to share with you and share some thoughts. We'll go through a few questions, sort of large topics that I think would be interesting to you guys, and then we'll try and save some time for questions. So make sure you keep those questions coming and ask difficult ones to this lot over here, okay? All right, so before we dive into the topic, a quick round of introductions. Now you see mugshots. In case you can't see from that back table to who these folks are, I'll let them introduce themselves in a minute here. Just to get started, I'm Vaishali Kamath. I'm the GM for New Ventures at GE Healthcare within the ultrasound digital organization. I'm an engineer by training. I've been in the healthcare field over I shouldn't really say, but 20 plus years. Been in GE about 13 and then done some product development consulting. Really privileged to have the opportunity to work with very, very smart people who've taught me an incredible amount. And the last few years has been focused on AI and digital technology and ultrasound in particular. So that's kind of my background. I will introduce or let my panelists introduce themselves, and then we'll get into the topic. So we'll start here first with Sam.
Yep. Good morning, everybody. Thank you for joining us here. My name is Sam Balga. I am the Vice President for Verisound Digital for the US and Canada. I've been with GE Healthcare for about 9 years, been in the healthcare industry for a little bit over 25 years. So.
Thank you, Sam.
My name is Kilian Köpsel. I am Chief Innovation Officer at GE Healthcare, and I am with GE Healthcare for 1 year. I came to GE Healthcare through an acquisition of Caption Health, which is a company I co-founded 10 years earlier with the goal to make medical imaging more available, more accessible with the help of ultrasound and AI. And before that, I was in academia and was researching deep neural networks, and so the AI that enables these kinds of applications, and was involved in some other startups to bring it to people. Yeah.
Thank you, Kilian.
I'm Sunil Agarwal. I'm General Manager and Chief Growth Officer for Caption Care. So much like Kilian, I tagged along with him as part of the acquisition into GE Healthcare a little over a year ago. I consider myself a bit of a growth strategist with the mindset of an operator. I spent the last 2.5 decades or so implementing and commercializing highly engineered software solutions in a service delivery methodology across both healthcare and hospitality verticals, ultimately bringing solutions out to hundreds of thousands of end users. So excited to be here today. Appreciate it.
And my name is Jim Hurley. I'm the General Manager for Point of Care and Handheld Ultrasound at GE Healthcare. And I've been in this role for about 5 years, working on Point of Care Ultrasound. But before that, and I've been with GE for almost 30 years and in the healthcare industry for over 35 years, trying to make better and better devices. So I've been making things in patient monitoring, in diagnostic cardiology, X-ray, MR, and now ultrasound. And I have to say, out of all of these, point of care ultrasound just seems to be the thing that has helped clinicians the most and has made patients' lives better. So it's been a pleasure to be on this journey with all of you.
Awesome. Thank you, guys. So I think all of you are probably very familiar with the topic of AI. It is everywhere these days. We've heard about ChatGPT quite a lot over the last year, and if you walked the floor at HIMSS the last couple of days, you probably saw it everywhere, right? Whether it's AI in workflow, AI in audio, in generative AI, all kinds of technologies really proliferating healthcare. So before we go into sort of that healthcare topic, I have a fun little question for my panelists here, and I'm going to throw a twist already, so we'll keep them on their toes, right? How do we make this real, right? What can we associate with as AI outside our healthcare or professional healthcare lives? How do we think AI is going to change our lives even before we come into sort of the healthcare and healthcare delivery phases? So I'll take a stab at that question first. So for me, it's, I feel like the biggest change that we might see is actually in education, in the way people learn, right? With particularly with the scary accuracy and efficiency with which ChatGPT is writing articles and papers. Imagine what is happening to the students today. And I feel for the teachers who have to actually, set the questions and be able to address the answers appropriately. So my nephew, who is now 14, I guess, a couple years ago, had said to me, I told him to practice his typing because he's going to use computers. Like, he's a digital native, today's generation. And he asks me, he's like, but why? I will just be able to speak to the computer. I don't need to practice typing. And I thought, oh my God, this is crazy. But that's today's generation, right? And that's the generation that all of us are actually developing devices for, developing solutions for. And that's the generation that's going to be both our patients and our providers in the years to come, right? So I don't know if you guys have a thought on how you think AI is going to change life outside of healthcare first.
Oh, okay. I'll jump in first on this one, Vaishali. I mean, for me, it's been pretty interesting. I mean, I'm a bit of a movie buff. And so for me, it's the impact on the entertainment industry, movies specifically. I mean, when you look at how Gen AI is beginning to meld itself already into what we watch on TV today or even in movies. Now think about as it gets integrated more into machine learning and the amazing transformation that's going to create for the entertainment industry and impact what we watch today. And it's, from my perspective, I'm not sure if any of you guys have seen the Dune movies, but, the recent one just came out, right? Very interesting piece there, right? Because there's Gen AI all over that movie, but there's no Gen AI in the movie. So take that back with you. Think about that for a minute if you've seen it yet. So there's no Gen AI in the movie. And so for me, transformational is really what I believe is gonna happen over the next 3 years around the entertainment industry. But I would also say there's a level of provocativeness, if that's a word, right? Because from my perspective, think about this for a minute. You're probably all familiar with SpongeBob, right? If you have kids, you've seen SpongeBob, right? Well, what happens if the writers and producers for SpongeBob decide, hey, we're going to use Gen AI to spin up a new character? How do you copyright that? Who owns that, right? So for me, I honestly believe that there's legislation that's coming down the road around that. There's some things going on in Europe today, just around that kind of legislation. So from a legal perspective, it should be really interesting on where it's headed. But for me, I'm going to be fascinated to watch the entertainment industry.
Interesting. Thanks, Sam. So, yep. Anyone else want to jump in on that one? Go ahead, Claire.
Yeah, I can go next. It's really good question. It's a really exciting time to live in because there's a lot that will happen. We have seen 10 years ago when this deep learning based wave of new AI came, how it changed lots of aspects of our lives. So now this is when suddenly speech recognition was working and we can talk to the phones and it actually works, and image recognition started working, and so which enabled self-driving cars, for example. But now with these large language models and generative AI, that was originally trained to predict language, it can generate language and do reasoning, and so now we can naturally interact with. And so I was quite shocked when this started last year. And so one thing that I find really exciting and to see is that it turns out that it can not just predict language, it can generate images that a lot of you have seen, and it turns out it can predict motor planning and motor control. And so I think it's now finally the time where we will see robotics coming into our world, and I wouldn't be surprised if we would have the first assistants that are in the world as robots within the next 2 or 3 years.
Wow.
And I think that it will change everything. I don't know how it would be if most of the people you interact with might not actually be humans anymore at some point, and that I think will come sooner than.
That's a scary thought right there. But if Killian is shocked, then I'm really worried.
Anyways.
Sunil, Jim, anything to add?
Sure. I mean, I think when I think about AI and technology, I do think about autonomous driving cars. And I think, when you think about that and electric vehicles, which have a lot fewer moving parts and require less maintenance, when you bring those two technologies together, I think we're going to see an explosion really of kind of transportation as a service in the future. And because the cost is going to come down, and it may not even be cost effective for us to own our own cars in the future, where you can dial up and say, okay, I need to be transported to work. Well, okay, I just need a small vehicle for that, and that comes. I need to take a family trip, and a different size vehicle comes for that. Or if I need to haul a boat, a truck comes for that. So I think transportation as a service with autonomously driven vehicles is going to be something that explodes in the next 5 years, in my opinion.
Awesome. Go ahead, Sunil.
So I'll take it, and I'm not a dystopian by any stretch, but I'll take us down a little bit of a different path, the way I see from an AI standpoint. Societal impacts that we haven't even conceived or aren't even aware of. These AI systems are rapidly increasing the knowledge of ourselves more so than we have on our own selves. And leveraging that information can be very opportunistic, but both in a negative and positive connotation, right? Like, I firmly believe that it comes down to what will be an end of privacy, but it doesn't necessarily have to have a negative connotation to it, right? I mean, realistically, the barrier right now to privacy has been more technologically focused than ethically focused. So I think it brings the ethics piece to the forefront, and we need to see more of that in the very near term, because again, it's inevitable. So
it's a good one.
Just open take, but
no, not it's reality, right? I mean,
it's real.
But we'll focus on the positive bits for the next half hour.
Right.
So how many people are familiar with ultrasound? We decided to use ultrasound as the backdrop to this kind of AI conversation because all of us work in ultrasound, so that's convenient. Familiarity with ultrasound? Quick show of hands. Clinical ultrasound? Okay, well, reasonable, good. Well, I was going to ask Jim, who kind of leads our ultrasound group here for Point of Care, to just give us a layman's description a little bit of, ultrasound and its journey in the clinical space and where it's come and why it's important. So, Jim, if you don't mind kicking us off here.
Sure, thanks. So maybe I'll just start with kind of what is ultrasound and where did it come from? And it really started, the technology started in the early 1900s when there were subs that were, in World War I sinking ships. And this was a big problem, of course. So scientists got together and they said, okay, how do we understand where these subs are? And they put ultrasound transducers in the water, essentially. So ultrasound being sound above the frequency that we can hear. And they aimed them at the bottom of the ocean, essentially. And they bounced the sound off the bottom of the ocean, and with the time delay coming back, they could see, how deep the bottom of the ocean was. And if there was something that was, closer to them than the bottom of the ocean, that you could also see from the sound bouncing off of it, that probably was a sub, and so they should take evasive action, right? And in the same way, this was developed over time by scientists. The transducer's much smaller, of course, and the frequency higher, but you can see things underneath the skin because the sound that's being produced by the transducer bounces off of tissue, off of muscle, off of blood, off of bone. And by reflecting back to the transducer and understanding the time delay, you can start producing a two-dimensional image of what's beneath the skin. So now you can start seeing into the body. And if you do this fast enough, you can produce a number of frames per second and essentially have real-time motion detected below the skin as well. And if you start fanning the transducer or the sound waves, you can do this over a space and you can map surfaces, and now you have 3D ultrasound. So that was really in the late 1990s. And if you, again, do that fast enough, you can have real-time 3D imaging, which we call 4D imaging. So that was kind of the advent of ultrasound. And the other thing that ultrasound can do is it can detect motion of objects below the skin. So now blood is moving, of course, and if you have sound waves that bounce off of a moving object, it's kind of like listening to a train going by. The frequency shifts, right? So you'll hear a train go by, you'll hear the frequency shift of the horn when it's going by. And that's the same thing that happens. We can detect the motion of the blood away from or toward the transducer by the shift in frequency coming back to the transducer. And we can display that on the screen as different colors, red or blue typically, as you see the blood coming toward you or away from the transducer. So it becomes an extremely useful imaging technology, seeing into the body, seeing the structures that are there, and seeing the motion of blood. And over time, what we've been doing most recently is because this can be used in basically any patient room. It doesn't require any special environment. It's not ionizing radiation, so you don't need a special room for it. It's not like magnetic resonance imaging where you need a lot of protection because there's a big magnetic field. You can bring it right next to the patient. And so our goal over time has been to make it smaller and smaller and invest in technology that can make it lower power. And so we've gotten to the point now, of course we created laptops in the past, but we've gotten to the point now where we can put this amazing technology into something the size of a cell phone. And this is essentially what I'm holding in my hand here, is a full body ultrasound scanning machine that you can use with your iPhone or your tablet. And you can now have that ability to see inside the body, in your pocket as a clinician wherever you're going. So this is the technology as it went from ships all the way to in your pocket for clinical use.
Fascinating. That's quite the journey, right? I mean, you can imagine that device now. It's going back into Jim's pocket, into hiding. But you can imagine that device in any clinician's pocket, going with them wherever they are, whether they are making rounds in the hospital or whether you're primary care physician or an EMT on an ambulance attending to an accident or a home visit, right? So this is why we think ultrasound is really powerful in terms of improving that access to diagnostic capability at the point of care, wherever the patient is, right? Because it's as Jim said, non-radiating, non-ionizing. It's a small form factor now, and it's affordable, and non-radiating as well, right? So it's a very, very safe modality. But the downside, it does require skill, right? It needs the user to know what they're doing, to move the probe appropriately, to get the right quality image, to get the right scan plane so that the diagnosis that is derived from that is accurate, right? And that's where some of the barriers to adopting ultrasound come up is there's not enough skilled users to be able to deploy that ultrasound at scale. And this is where technology, again, like the next generation of technology can help and therefore proliferate that use of ultrasound. So Killian, I'm coming to you next. Can you talk to us a little bit about where you see AI helping with this barrier that we talked about and kind of how it can bring more users to using ultrasound carefully? Committedly.
Yeah. As Vaishali described there, you still need an expert to do ultrasound, and in fact there are lots of expert skills that are needed. In the beginning, you need an expert in the acquisition of ultrasound. So these are for cardiac ultrasound of the heart. There are sonographers, for example, or sometimes radiologists do also ultrasound. So there's a specific skill to find the right imaging plane and then do a recording when you have a good image. And so this is what AI can do, and it's called ultrasound, AI-based ultrasound guidance. So we have developed such an algorithm, so the first FDA-approved version of that. There are other companies that develop those kind of algorithms, and they can then enable medical personnel that is not specifically trained in ultrasound to acquire good images. And so that can be someone who is doing a patient visit or in an ambulance, or also someone who's coming to people's home in rural areas. And so I think this has a great potential to make medical imaging more equitable and more accessible, because a lot of people in developing countries don't have any access to medical imaging. And even in the US, there are rural areas where you have a couple of 100 miles to drive before you get to someone who can do that. And the local facilities could be enabled with this AI-based ultrasound to acquire those images wherever the patients are, and then the recording is done automatically. The digital images can be uploaded to the cloud, and then they can be remotely reviewed by experts. This is the second type of skill that you need. You need an expert who then does diagnostics. So in the case of cardiac ultrasound, you need a cardiologist to look at the images and decide what is going on here with this patient. And of course, they can only work on images that have diagnostic qualities. This is why the acquisition is so important. But once you have the images, you can remotely do the diagnostics. And but even there, AI can help, because these cardiologists there's a limited number of them, and it's a very expensive resource. And the power of ultrasound is you can bring it to many more places, and you can scan more people earlier before they actually have very bad disease. But then someone has to handle all these images, and so AI can help to do assessments and then maybe triage them into the cases where everything seems to be normal, or the cases where there's something going on that a cardiologist should have an extra look on. And this way, this expensive, high-quality resource of these medical experts gets to the people that need it most. And so I think that is relevant all across the world. And this is, I talked about cardiac ultrasound because this is one very important area, but the same holds for other areas. You're all familiar with obstetrics ultrasound, right? In the US, it's very common that you get a pregnancy ultrasound scan, and you are aware of all kinds of high-risk conditions that might be present, and then you can act on it. But in a lot of places, I think it's 50% of the women around the world don't have access to these scans. And one barrier was how big and expensive these ultrasound devices used to be. And so hardware companies have been chipping away on that and have now made this possible to do it anywhere. But the other barrier is the skill. And so with guided ultrasound, you could enable a rural midwife to scan a patient in Africa at home and then make the decision, can you give birth at home, or do you have to go to the hospital? And that would save a lot of lives if people can make the right decisions. And I agree with you that of all the medical imaging modalities, I think ultrasound is so exciting because it has really the potential to be as ubiquitous as just a regular camera, right? You have a camera on your phone, which we didn't have like 15 years ago necessarily, and you can have ultrasound with it as well today.
Excellent. Thank you, Kilian. No, you hit on a very important point there, just around that remote access. And it's not, Africa and other emerging countries certainly have that problem where you have a very disparate ratio of clinicians and care providers against the patients that need it. And so technology like this could help us really reach that population. But it's not just in emerging countries. Even in the US, there are rural care deserts. And you might have heard about the recent initiative that the White House has started, the First Lady has started specifically around women's health in the US. Because even in a developed country like ours, we have a fair number of women who actually don't get that antenatal screen. They don't have access to good ultrasound screening or good antenatal care within sort of the realms in where they live. So having to travel long distances is a deterrent, right? So there are significant rural care deserts even in this country where we believe technology like this can help get that care to people and improve that access. But the other thing, Kilian, you hit on was about the experts, right? We have shortage of skilled sonographers, but also skilled clinicians, cardiologists, OBs, all of those experts who can interpret those images and be able to also, provide that diagnosis. So how can we help some of this increase of care or increase of access to care? I want to ask Sunil to talk a little bit about a care provision service that he and his colleagues have brainstormed here. Sunil, can you talk to us a little bit about how you can help solve that access problem?
Yeah, no, I appreciate that, Vishali. I mean, so the application of these technologies is really where the rubber hits the road. So what we're looking at, I mean, it's widely known that heart disease is the #1 killer in the U.S. The unfortunate statistic is, upwards of 18 million people a year die globally from heart disease. But yet there is no program, asymptomatic approach for preventative measures around identifying or detecting disease early. So leveraging the technology that's associated, we've put together a program which is basically a turnkey end-to-end echo scenario that while the technology is still complex, the approach is fairly simplistic, right? It's engage, enable, and manage. So from an engagement standpoint, what we're looking at is we work with groups to identify subsets of their patient population on known leading key indicators or risk factors that are associated with the probability of heart disease. We enable workforce solutions, be it within hospital and health systems, clinical practices, what have you, to basically allow more medical professionals to acquire these diagnostic quality images with the caption cardiac guidance technology coupled with the point of care ultrasound handheld device platforms to bring this to scale, right? So, the numbers we had seen on the previous slide and Killian had mentioned, 80,000 sonographers, maybe 15,000 of which are adept at, acquiring a cardiac image. With the utilization of this technology, we can literally put that in the hands of millions plus medical professionals that can acquire these images. So from the enablement standpoint is working with workforces out there to acquire images at scale, and then the management. And the management is really where it comes to play, is, a report is generated with a cardiology overread associated with that to identify a care management pathway in advance of any incident happening. So a proactive approach to the management of heart disease rather than reactive and waiting, which can have obviously, catastrophic clinical outcomes, but have a significant impact on medical margin as well. So, that's what we're looking at, and wouldn't be possible without AI.
Right. No, that's a very strong, powerful offering right there. And Sunil talked about cardiology, but of course there are other disease conditions, other sort of affections that people have, which you could enable, additional programs like that if there was more AI technology available on systems. And I think that's going to bring me back to Jim for a second here. Jim, talk to us about what you're hearing from the market and what our customers have been telling us. Where do they see the biggest needs in terms of AI technology? What do you think is going to happen with, whether it's handheld or portable ultrasound?
Sure. Yeah, I think we look at AI in a couple of different buckets in handheld and point of care ultrasound. I mean, the first is guidance, and we've talked a lot about that already. And we expect that to be able to be integrated into handheld very soon, and also, as Killian said, cover a lot more anatomy than just cardiac. You can think about it for abdomen, for heart, for OB, for MSK. So all of these different areas, I think, will have guidance, and that'll enable people that don't have as much experience to be confident in scanning. I think the next thing that we're hearing from our customers is that guidance isn't only for novices or inexperienced users, but we need guidance for more experienced users or even expert users to make their jobs more efficient. And so we fully expect to be able to change guidance in a way that makes it more meaningful for expert users, and that should be coming as well. In addition to that, we've been told, hey, many times we're not able to bill for some of the scans that we do because we don't necessarily collect all the images that we need, or they're not of the right quality. They're not clinical quality, so we can't bill for them. So this is another way that we believe AI is going to help clinicians ensure that the images are of the high quality and have protocols that are more automated, so that you select a protocol and using handheld, and of course handheld is a two-handed operation, right? In one hand you're holding the display, in the other hand you're holding the transducer. So the more automated you can make it, the better. So you can imagine protocols in the future where you put the probe down on the patient after you select the protocol. It recognizes the anatomy, it selects the preset, auto optimizes the image, and then when you get to the image quality that you want, it auto saves the image as well, and then it auto advances to the next image that you need to acquire, and keeps going through that whole thing until you've completed the protocol. So now you've collected all the images. And again, this is our hypothesis, right? You've collected all the images. You've guaranteed they're the right quality, and now it could enable more of the work that's being done in the hospital to be billed for. So that's something that our customers are really asking for. And then finally, I think the kind of the pie in the sky is, I'm going on rounds. I want to be able to do all the scanning, make the decisions that I need to make while I'm on rounds. But when I get back to my desk, I want all of those images to have gone through a measurement package with AI, do the measurements, and create the reports, so that when I come back to my desk, I don't have to create all of these reports. I can just review them, make any modifications that are required, and send them into the EMR where the data can be stored and used there too. So those are some of the things that we see, I think, going forward.
No, that's excellent. Thanks, Jim. I think the workflow piece of it, I mean, we haven't hit on that. We talked a lot about the AI in the device for clinical decision support or scan guidance, but the workflow piece is actually super important, right? I mean, how many of you have heard of woes around workflow in the hospital system and how it kind of either really help efficiency or really bog people down? I mean, there's already a burden on all of our care providers. There is way more traffic in the hospitals than they have time for, and so the more efficiency we can deliver for them with intelligent automation, with smarter, easier to use solutions is going to be helpful for them, right? And so that brings me to a question for Sam. Sorry, we've kept you quiet for quite some time.
No, absolutely.
But talk to us.
You teed me up, by the way.
I'm teeing you up, yes. Sorry, and didn't mean to steal your thunder, but tell us, I mean, you work in kind of the workflow and reporting space. Tell us a little bit about what customers are asking for and how you see this helping in terms of automation improving their efficiencies.
Yeah. No, thanks, Vaishali. Yeah. So, I mean, the reality of it is, and I think you guys are all probably feeling it, right? Ultrasound itself is just advancing so quickly, and the access, as my colleagues here had talked about, and the utilization is a pretty critical part of getting that scan complete, right? And ultrasound, again, continues to be the staple across a lot of the care areas, right? Women's health, cardiovascular, radiology. But the real interesting area is really becoming point of care. If you look at even the impact of COVID, right, where you had such an influx of patients that were going through the ED that needed ultrasound access, it created a bit of the wild, wild west, quite frankly, right? I had a conversation with a CIO several weeks ago, and we were having a conversation around workflow and access and decision-making around where ultrasound was happening in his health system. And he said to me, Sam, the one thing that keeps me up at night is that provider that purchased what Jim had in his hand off of eBay for $250. That's not the price, Jim,
oh dear.
But bought it off of eBay, right? Comes into my health system and starts doing scans, right? What's happening with that data, right? Where's the workflow component? Is it integrated to my EMR? Are we capturing the opportunity there from a workflow perspective? And so that's become very real, because in an orders-based environment, which a lot of these other care areas have been, and a lot easier to track, right? There's been a huge commitment. Obviously, a lot of your health systems, I'm sure, made a commitment to their EMR, mandatory driving workflows, right, within the EMR. But now you have this segment out there that is a bit wide open. And when we look at the challenges in that segment, it starts with, first of all, the challenges on the providers themselves, right? If we just want to focus on the ED for a minute, think about this for a minute, right? A patient presents themselves into the ED, abdominal pain. They got this great tool, right? They've got ultrasound to have an opportunity to go in and utilize that tool, right? So they make a scan, get to the diagnosis, and what are they trained to do? Move on next, right? But now what happened to all that data, right? What happened to the ability to report off of that? What happened to that image capture, right? It went nowhere. And that's where the key to being able to take advantage of the opportunity of what happens after the scan is really built around the need for a good quality workflow. And when I say quality workflow, I tend to see out there either fragmented workflows or no workflows at all, when I go and visit sites. Fragmented workflows I've seen, walked into an ED last month and I had this provider took out a cell phone and took a picture of the ultrasound image and loaded it up into their EMR. Is that compliant? Is that something that you want them doing, right? And so, but in his defense, that was the only opportunity he had to really drive the workflow and capture that data, right? But we also have to realize and respect that the pressure that are on these providers is to get that scan done, to care that patient, right? And so the goal needs to be, what can we do to automate that process for them? What can we do to make it as frictionless for them, to give them the opportunity to complete the scan, capture the reporting data, to be compliant, get the images to the right location, as you can see up here on the slide, and be able to integrate to the EMR. That's a significant challenge, right? Be able to integrate to PACS. Wherever you want all that data landing is a pretty critical part, but yet keep that completely out of the hands of that provider. Let them focus on patient care. And so those are probably the two biggest challenges that I hear around what's happening when it comes to the advancement of ultrasound is connectivity and report and image capture. So now what's the old adage, right? They say, okay, where there's an issue or there's a problem, there's always a solution and opportunity, right? And so if you look at what's happening, and I'll stay focused on point of care right now, but quite frankly, we can probably go across all the different ultrasound care segments. What I just walked you through was gaps, right? Gaps in workflow, right? So is there an opportunity for revenue capture, right? Think about this for a minute, right? Every ultrasound scan that occurs, right? Is there an opportunity to capture both the technical as well as a professional component, right? Is there billing opportunity there, right? Is there compliance challenges that we're looking to overcome, right? Can we impact length of stay, right? Ultrasound utilization is not going to go away. It's going to continue to grow. I've probably been at more ultrasound workshops, especially for the point of care space in the past year and a half than I've been the previous 9 years, right? And so the challenge is what can we do as a partner at GE Healthcare to continue to support our partnering health systems with how to manage to capturing that workflow. I'll give you a little shameless pitch here. We have a solution. It's called Viewpoint 6. It's a middleware that automates that process for the clinician, because we realize that you need an encounter-based scenario for a lot of the providers that you're working with. They don't have the luxury of dealing with that patient and walking over to the EMR and entering all that data on the order. They're just not going to do that, right? I mean, I've had providers tell me, Sam, I'm just not going to do that. I don't have time for that, right? But there's opportunity there where we can create an environment for them, whether it's encounter-based or order-based, to capture all the data that they need and get it to the right location. So we're driving compliance, we're driving collaboration, we're driving the opportunity for revenue capture, and probably so much more that we would begin to do a dive in with our customers on. And that's really a workflow analysis that we support our customers on when we go through this. But my main point is, if there's a gap in your health system today, and it's in the point of care space, look at how your providers are currently executing on their workflow today, understand what their needs are, and workflow and an automated workflow can help them get from point A to point B, and as pretty much a frictionless process overall. And so from a workflow perspective and automation, we're seeing that's where it's headed, quite frankly, because point of care workflow scanning is not going away. It's going to continue to have more access. And then what can we essentially do to our partners and our customers to be able to support them? And that's through an automated workflow. So,
awesome.
Yeah.
Thank you, Sam. No, it's the number of times we've heard about just the current process is broken, but we have no other process is a common theme amongst a lot of current health systems here. And so improving kind of that workflow with really seamless and user-friendly sort of solutions is going to be key to unlocking that efficiency that we really desperately need. So switching gears for a second, how many of you have been sort of bombarded with Gen AI on the HIMSS floor this year? Right? Pretty much every booth seems to be talking about Gen AI, right? And how quickly it has proliferated is amazing. Normally, healthcare is fairly slow, right? We are the late adopters of technology, and rightfully so. We have, a responsibility of patient care and safety, etc. But it has been impressive, I think, to see how much Gen AI has proliferated just between last year and this year. So I'm going to turn to our AI expert here for a second. Killian, can you talk to us a little bit about what is Gen AI and how you think it's going to impact what we've been talking about right now, which is ultrasound and access to care?
Yeah, I want to take a step back and maybe start with AI in general. So why is it called AI, artificial intelligence? So in the interaction of the medical system or medical provider and the patient, there are some tasks that are done by the human, and there's some parts of the process that's done by technology. So there's, of course, the imaging hardware, but Sam mentioned a lot of places where technology is helping the human, and AI is basically an overall term that captures all the capabilities that traditionally we thought only humans can do, where technology cannot help because it uses intelligence. So and as technology moves into this space, we call it artificial intelligence. And I think the first big successful progress was about 10 years ago with this deep neural network. So that is, now we call it traditional AI. So it's 10 years old, so it's already traditional.
Already too old.
Yeah, and it has solved problems that until then no computer could solve. So if you look at an image and you want to recognize, is there a monkey in this image, or is there a cancer cell in this image? These are the kind of tasks that only humans could do. And this kind of technology was modeled with neural networks. So it was modeled according to how we think the brain is doing these kind of processes and looking at images. And it worked well for images. It worked well for sound. So this is why suddenly it could recognize your voice commands. And that is really useful because as we said, in order to make clinical decisions, you need this visual input, and so this is why it was really is driving this point of care ultrasound and AI kind of business. But there are still, with this technology, as we said, you can make the images available all around the world and wherever patients need it. But there's still many steps where we need additional experts, and this is, I think, where Gen AI comes in, because it resolves some of the limitations that the traditional AI had. So these Gen AI systems, you probably have seen, so the main thing, it can process language. So it has a much more natural interface to humans, but it can not only understand language and then process output, it can even do some reasoning. You can even ask it questions, which I found really, really surprising that it had this capability, because anyways.
It's a little scary, to be honest.
I personally, and anyway, so maybe I couldn't. I was really surprised by that because what started as a natural language prediction model can now do this reasoning, and it is also much simpler than with these deep learning based AI to integrate multiple modalities. So now suddenly you can look at images, and you can look at sound, and you can look at text and integrate all of this. And this is something that before humans had to do. So you have this different diagnostic modalities, and you need one expert, or actually in today's system you actually need multiple experts because it's a different expert who can understand this different type of modality. And then you have to, and this is now can all be done by one neural network, by a Gen AI network to combine those insights. And then the other part that was done solely by humans was this reasoning and trying to integrate those modalities and then make treatment decisions. And I'm a firm believer that there's a place for human experts and physicians, but I think the amount of help and assistance that an AI system can do will be much more bigger, much greater. And so we will see how this evolves, how the interface between technology and the human, how it changes. But I think the interaction will become much more human-like. You can interact with this AI system how you would interact with another colleague, and you can ask them, and if they have a different opinion, you can ask what does you make think that, and then you get so and I think this is the power of this generative AI, and
awesome.
Yeah, anyways, that's
it's really something to look forward to. I think the way we interact, that's a really good nugget right there. The way we interact with technology and with AI is likely to shift with these new technologies here. And that brings me kind of to a point where I'm turning to you, so I can rest my voice a little bit. Any questions so far? Hopefully those were kind of some useful nuggets across a different sort of set of topics there. Did that spark any questions for you guys? Does anyone have anything burning that you would like to ask these folks here?
What's the cost difference between a smaller device and a normal ultrasound?
Well, there is a huge range. And I mean, GE Healthcare as a company, we have ultrasound systems across the board for high-end cardiology, high-end radiology, all the way to the pocket system that Jim showed you, right? So it is a huge range, and it depends on the capabilities of the system, what kind of probes you have with them, etc. But happy to have that conversation so you can see the portfolio and figure out what fits the need.
It's not $250 though.
Yes, it's not. Just to be clear, right?
Yeah, it's just one thing I want to add. Historically, if you look at computers, for a long time, there were only these mainframe computers that cost like hundreds of dollars. And now we all have a computer in our pocket and can afford it, right? And then similar with cameras, I remember digital cameras was this expensive thing. It cost like $10,000. And now, again, you have 5 of them on your phone. And similar, I think, imaging technologies have the potential to go this path where it's just much more affordable. And that doesn't mean that we still have supercomputers for $1 million, and we still have super expensive cameras. And so I think there's a space for high-end technologies that the biggest experts can make use of, but then there's the potential to get it into everybody's hand. And so that is really exciting.
That's a great analogy.
It's going to be more affordable.
Yes.
Yeah, it likely will be very affordable. Yeah.
Yeah, absolutely. Go ahead.
So I have a question regarding how innovative AI is. So I'm very amazed at how well the technology has evolved. And in my I have a personal situation. Right, my father had a ejection fraction of 18%, and he's 80 plus years old. And they suggested CT angiogram. But CT angiogram is minimally invasive, but yet can cause issues, infection or stroke. So they said, no, it's too old for a CT angiogram. So I'm wondering if AI can help ultrasound, get to a point where it can be, non-invasive and do things that, other minimally invasive technologies can do.
Yeah. Go ahead.
So I want to answer to that. It's sorry to hear about your case, and this is exactly the kind of cases that almost everyone has either a direct experience or through a friend or family member. So one thing I want to make clear, what we have been talking about here was always diagnostic ultrasound, right? So there's the diagnostic part, and then there's treatment. And on the diagnostic part, I think there's an extreme benefit. So we developed this guidance for ultrasound, and we also actually developed an automated ejection fraction algorithm. And so now you have everything in your pocket that allows you for a particular patient to tell what is the ejection fraction. And if it becomes more common to do checkups with ultrasound, then you would catch these kind of cases when the ejection fraction goes from 65 to 55 to 50, and you don't only catch it when there's symptoms there, and then you realize, oh, it's 15 now, the ejection fraction, right? So I think there's the potential to catch it earlier, in the same way as we have an inspection with our car and see how the engine is doing. In my opinion, we should do the same with our hearts, right? And that is not widely done. And so I think this is an answer where maybe, hopefully, there is a future where we catch these kind of cases earlier before it becomes so
severe.
so problematic. And then I'm not from the medical field, so I can't answer your treatment question. But the diagnostic ultrasound is completely non-invasive, and I know that there are also non-invasive treatment ultrasound therapies, but I don't know if it applies to your case. But in any case, even on the treatment side, when you have surgical interventions, I do believe there is room for AI to make that higher accuracy and easier and so on, and have more, maybe the risk could come down for interventions that, maybe a good example is also there's this these heart valve replacements became much more easy today. You don't have to do full chest open heart surgery anymore. You can very minimally invasively replace a whole valve. And so there's a lot happening, and I do think AI has a place there to bring it to more people than you would otherwise be able to do.
I think one other point to add to what Kilian said, I mean, you talked about CT angiogram for visualization, if the initial visualization before the treatment as well, and there is a range of ultrasound capabilities. So if you look at the cardiovascular systems that we have, the 4D ultrasound that Jim alluded to earlier, that gives you sort of a real-time motion picture of the heart. Now it may not cover all of the possibilities or all of the visualization that a CT angiogram can give you, but it certainly goes a long way to visualizing kind of the functions of the heart and all the different valves and chambers and things like that. So there is certainly more than what the V-scan that Jim just showed you, right? That is a fairly simple point-of-care device. But as you go into the more advanced ultrasound systems, you certainly get that additional capability to not only visualize but also measure and analyze the anatomy a lot better. So,
question. Thank you for the presentation. Question for Sam, I think, on the compliance piece of it, and anybody that has a comment on this. With helping improve the workflow, so I get it, if you keep the image in the system and it stays within a channel that's appropriate, then that's easy for compliance. Is the system, is Viewpoint or any other system helping with compliance, that is preventing someone from taking a photo of the image, or is there any other audit features that are built into the AI system that would, further help in compliance?
Yeah, there are. I mean, it's a great question too, because I always say it starts at the scan, right? And once they complete that scan, then can we automate that process to create a level of security and standardization to make sure that we are compliant, and those are protocols that we would work, and again, I can't speak for other vendors, but we work with our providers and health systems to assure that those administrative protocols are in place, so we can manage to that moving forward, right? So you're just, to your point, right? So you're just not having every image flow in, and so you have a level of audit trail against it. Yep.
Yeah, I think just by providing a compliant way to handle the image, you reduce the incentive to take this picture. And so I think the person, as you said, they probably knew that this is not the most compliant way to do it, but there was no other option. And so I think, naturally, I think people will stop taking.
That. I don't think you can stop people from taking pictures. That's down to the individuals and the policies that the health system would implement. But certainly agree with Kilian, right? If you provide alternatives that are easy and compliant and right there, then there's less desire or less need to go and do things with your phone. Basically.
I will say there's opportunities with workflow to create that audit trail, right? So who was that provider that took that image, right, and get that documented all the way through the process. So there's absolutely opportunities for that. Yep.
Yep. Other questions? No? Everybody good? Was that helpful to kind of spark some thoughts in your heads and hopefully get you excited about what AI technology could do in the access to care, access to healthcare delivery, and improving efficiency? Any final sort of thoughts, folks, before we close out? I think we're nearly at the end of our time here. Any final thoughts anyone would like to add?
Sure. I'll add a couple of final thoughts. Again, it's just, the real world application of this, right? Technology for the sake of technology is not nearly as sexy as you would think, right? So, tying the software pieces together with the hardware pieces in a real world application like we're seeing for, acquiring a diagnostic quality image of the heart. We talk about instances like that, and, I often ask people, Like, when's the last time you actually looked at your heart? Yeah, you may have listened to it, you may have heard it, but making something like that commonplace and the ability to address what is, in this real world application, the number one killer, that's why I do what I do. The impact. I want to bend that curve. I want to look back years from now and say, we had an impact because we brought that to scale, right? We can do this mass. This is what AI does. It's the connectivity of the hardware, the software, into a real world application that can be brought to scale that without AI, it's just not going to happen. So it's exciting.
Yeah, and just to add to that, ultrasound is advancing, right? I think what you heard from today from us is with the utilization of AI, the portability and access that ultrasound creates, it's going to continue to advance faster. We're going to get it more and more in the hands of so many different type of providers, regardless of their expertise per se. But the reality of it is it's going to continue to be used as a tool. I have one of the members of my team had a conversation with a group of physicians recently where he talked about, here's a handheld ultrasound. What's the difference between this handheld ultrasound and a stethoscope, right? And how can you measure that? That's where ultrasound's heading, right? It's that kind of utilization. And I think you're going to continue to see it more grow and grow moving forward and continue to advance as we get more access and we get it in more of the providers' hands and get them comfortable with it. And that's where AI is going to make a real key difference with that whole process. So, yep.
Go ahead, Gillian.
Yeah, I wanted to emphasize something that Vaishali already mentioned, is how quickly this new technology moves into medical products and on a conference like this and to the users, because that is something I think that really changed 10 years ago when with the last wave of AI, the big consumer companies like Google and Apple, within a few months they had this AI integrated into their devices and made more profits out of it. And we were a Silicon Valley-based startup, and it took us several years to get it into a medical device. And when we went to these conferences, nobody was talking about AI. And now everyone is talking about it, but it's not just the old AI that's 10 years old. Even the AI that was developed last year, you can already see in products that are here on the floor. And I think that is really exciting, that not just the consumer and advertisement profits from AI, that the patients profit from it on a similar scale. And so I'm really excited about that change in agility and speed in the medical field.
Absolutely. Jim?
All right, maybe just one final thought. I think as I was walking around on the floor, I was really impressed by some of the improvements that are being made in healthcare due to AI and having that data. But what really hit me as I started thinking about it is, where did that data come from? It came from making sure that we can put devices in the hands of clinicians, that they're acquiring the right image or the right data, the workflow is automated enough to get it to the right place. And now these insights that you were seeing that are really impacting healthcare can be made because of all of the other ways that AI has already been applied. And that really struck me because it's being applied in so many different areas, and these things all have to work together to get the big insights to make these big improvements.
Yeah, no, absolutely. It's sort of an ecosystem of things, right? At every step of the way, at every function that happens in our sort of end-to-end workflow for a patient is going to be touched by AI in one way or another. And I think, as you heard from all of my panelists as well, and I join in that, very excited about what this could bring for us. And I believe we are sort of at that tip where we can certainly start to bend the curve and make a huge impact to lives of people everywhere. They don't all have to be patients, it's people too, right? Everybody has some kind of interface with the healthcare system at some point in their lives. And I think if we can make that better, if we can make that more efficient and cost effective and reach people who live in care deserts, I think that is the opportunity we have with this technology, and really exciting to kind of see that come to fruition and bring it forward in the years to come. So definitely a very exciting topic there. Hopefully all of you share in that. Thank you again for joining us for this hour. There's lots of different sort of lectures and shows going on, but we appreciate you spending time with us. And thank you again for coming.
Thank you.
Thanks.
Thank you.